When COVID struck the nursing home where Dilys Patterson's mom lived, she pulled her out fast, fearing how quickly the virus would spread in a tight room Joan shared with 3 others.
It just seemed like it'd be impossible to control that infection.
It was. 67 residents have now died at the home, and data analyzed by CBC Marketplace reveals how the buildings themselves may be connected to how deadly an outbreak becomes. 22 years ago, Ontario mandated new nursing home rooms house no more than 2 people, in large part to control infection. Everything from visitors to privacy curtains can spread viruses. But rooms that already had more than 2 beds have been long grandfathered in place. So now, about a third of Ontario's beds only meet a nearly 50-year-old standard. It is in those facilities where 57% of the deaths have occurred. Older buildings have a higher death toll, the vast majority of which are owned by for-profit companies. An association representing them says there is insufficient funding from government for renovations. But elder advocate Jane Meadis points out not-for-profit homes have upgraded faster than homes run by for-profit groups.
And frankly, there's no impetus for the homes to rebuild. They are full. They don't have to change in order to keep full.
Makes me wonder why it's been allowed to go on so long.
Dilys is now looking for a new home for her mom and has no interest in a 4-person room this time.
So David, if families want rooms with fewer people, why haven't there been more renovations?
Well, the homes don't have to pay for renovations in order to fill those beds. There's 37,000 people, Adrian, who are on a waiting list in this province alone to get into a nursing home. Families often desperate to get at one of those beds, even if it means going into a 4-person room. And remember, the rules say you haven't been able to build a new home like that for a couple of decades with multiple people, 4 people to a room. But if those already exist, well, that's okay. Take Camilla Care, this nursing home right here, plenty of multiple resident rooms. And tragically, Adrian, 1 in 3 of the residents here has died.